So, doctor, when a patient is diagnosed with Alzheimer's and a family member comes in, because I'm sure they come in to talk to you, they obviously sit down with you. What can they start expecting? Here's day one. Your mom or dad has Alzheimer's.
I mean, they
walk us through. Paint the picture.
Day one, usually they start to develop changes in memory. My father forgot the stove on. My father cannot remember where he put his keys. And gradually, they start to have problems recognizing things. They cannot recognize a book when they see it. They're not able to take care of themselves. They're not able to bathe themselves. They're not able to clean the house. They start to forget how to take their medications. They start making mistakes with their checkbook and things like that. In the younger population, you're going to see decline in the productivity of work, for instance. They're not able to keep up with work the way they used to before. Gradually, you're going to see changes possibly in their language, so they're having problems getting their words out or speaking correctly. You may see problems with sleep. Patients with Alzheimer's tend to have significant problems with sleep. Eventually, they will develop problems with behavior. They could become agitated. Sometimes they become aggressive. Sometimes they'll wander. They'll get lost. You take them out on a car ride, for instance, and they won't know where they are. They go out for a walk and they get lost. And this is gradually going to get worse to the point where they're not even going to be able to dress themselves, to take care of themselves, to brush their teeth, do any of the normal activities of daily living that you and I take for granted.
Absolutely. And this unfortunate progression can start happening in what? Within months, within 6 months, within a year? It's different for everyone?
It's basically different for everyone, but for the majority of people, it progresses over the next few years. I mean, the life expectancy of an Alzheimer's patient, once they've been diagnosed, and it all depends on when they were diagnosed, it's anywhere between 3 and 11 years. So it's a progressive disease that could last, say, about 10 years, more or less.
Why is sleep affected where they're up all night? Is there a reason for that?
I'm not sure that I know what the reason is,
right.
But you would say the patient doesn't know where they are, they get confused, and they might start getting agitated, they might start thinking, and possibly they're not able to sleep because of that. They wake up and they don't know where they are.